Here's another photograph of another person who sent in photos. Now, if I pinch and zoom, you can clearly see this orange area here is roots. That means the gentleman has lost bone, and the same here. So we know that there is active bone loss. We just don't know the full extent of it from this picture. But then we look at the next picture and we see the following. Can you see that this tooth is leaning over like the Leaning Tower of Pisa? It used to be like this, and now it's like that, which means even though it's there and it might be making contact, it's not in the correct position for long-term stability. Now we can see the lower teeth clearly out of position. That one is tipping in. We've got a thin ridge of bone here because this is what happens when you lose teeth and you don't stimulate the bone. It just wastes away, just like anywhere else in the body. So if you were bedridden, the bones in your legs would waste away. It's the same when you take teeth out and just leave it. But this is why we do the assessment, because when we take the scans, we can actually see how much bone volume we've got left. And we don't need anywhere near as much as people think. What we actually need is 4 millimeters in width, just 4, less than half a centimeter, and a centimeter high. Let me put that into context for you. In a healthy mouth, you have anywhere from 10 to 15 millimeters of width, and height can be up to 30 to 35 millimeters. So you have to lose a lot of bone before we've got no bone to work with. But bone isn't the only criteria. Alignment and adaptation is the other criteria, which we can begin to see with these photographs. If we look closer here, we can see that they are further down than these. Why have they drifted? Because if you remember the gap on the lower, when they were like this and the lower tooth was removed, the top tooth just keeps drifting. You won't notice this because it's a bit like watching your hair grow. We go for haircuts, we just haven't noticed the hair growing. It's exactly the same when you have gaps in the mouth.